Today, we are talking about a medical emergency where every single second counts: a stroke. You might also hear it called a cerebrovascular accident, or CVA. It's an event that can change a person's life in a blink of an eye, and understanding what's going on inside the brain is absolutely key to fighting it. So here's our roadmap. We're going to start with a patient's story to see how this crisis can just suddenly appear. Then we'll get into why the brain is so dependent on its blood supply. We'll explore the too many ways that supply gets cut off, learn how to read the signs on the outside to figure out what's wrong on the inside, and finally, really understand why the response is such a frantic race against time. To really get a feel for what a stroke is, let's not start with a textbook definition. Let's start with a person. Okay, so picture this. A 68-year-old woman is just having breakfast, maybe sipping her coffee, and then, boom, in an instant, everything changes. The left side of her face starts to droop, and when she tries to speak, her words come out all jumbled and slurred. This isn't something that happens gradually. It's a sudden, terrifying sign that something has gone terribly wrong inside the body's command center, the brain. So what on earth is going on in there? That is the big question we're going to tackle. And to understand that sudden breakdown, we first have to appreciate just how demanding the brain really is, moment to moment. All right, let's take a quick look at how things are supposed to work. Your brain is an absolute energy hog. I mean, it's only about 2% of your body weight, but it devours 20% of your oxygen and calories. Its entire operation hinges on one critical thing: a constant, steady, uninterrupted flow of blood. So when we talk about a cerebrovascular accident, or CVA, what does that really mean? Well, it's a sudden, catastrophic break in that lifeline. See, brain cells have no way to store fuel. They depend on that second-by-second delivery of oxygen and glucose from the blood. When you cut that supply line, they start to shut down, and within minutes, they start to die. That right there is a stroke. Now here's where it gets really interesting. This interruption, this cutting of the supply line, isn't just one single thing. It can happen in two totally different ways, and which path it takes determines everything that comes next, from the symptoms all the way to the treatment. And this image shows those two culprits perfectly. Over on the left, we have an ischemic stroke. The best way to think about this is like a clog in a pipe. There's a blockage in an artery, and blood just can't get past it. This is the most common type, making up about 87% of all strokes. Then on the right, you see a hemorrhagic stroke. This is more like a burst pipe, where a blood vessel actually ruptures and blood starts spilling out into the brain tissue itself. Let's dive a little deeper into that clog category. It can happen in two main ways. A thrombotic stroke is a local problem. Plaque builds up in an artery in the brain over years, and then a blood clot forms right on top of that plaque, basically sealing it shut. An embolic stroke, on the other hand, is a traveling problem. A clot forms somewhere else, a lot of times in the heart because of a condition like atrial fibrillation, and then it breaks loose, travels up to the brain, and gets stuck in a smaller artery. Now let's look at the burst pipe. By far the most common cause is chronic high blood pressure. Over time, that constant pressure just weakens the artery walls until one finally gives way. Other causes can be a ruptured aneurysm, which is like a weak balloon-like bulge on an artery, or something called an AVM, which is basically a tangled mess of abnormal blood vessels. With these, it's not just that cells downstream are starved of blood. The bleeding itself increases pressure inside the skull, literally crushing brain tissue. And we absolutely have to talk about this crucial warning sign. It's called a TIA, or a mini stroke. This is when a clot causes temporary stroke symptoms, but then it dissolves or moves and the symptoms disappear. It is so dangerous to just ignore a TIA. Think of it as the brain's fire alarm, screaming that the conditions are perfect for a massive, permanent stroke to happen very, very soon. So that fire alarm is a huge deal. But whether it's a TIA or a full-blown stroke, how does that crisis happening inside the brain actually create the symptoms we can see on the outside? Let's connect the dots between the damage and the signs. This is where a simple tool like the BEFAST mnemonic is incredibly powerful, and really, everyone should know it. Each letter points to a core function of the brain. Is there a sudden problem with B, balance? Any changes in the eyes, like vision loss? Is one side of the face drooping? Is one arm weak or numb? Is their speech slurred or strange? Any one of these means it's time to call 911 right away. No hesitation. Let's use a really specific example. If our patient from the start of our story is having trouble getting words out, that's called expressive aphasia. It tells us something very specific. It points to a problem with blood flow to the brain's language production centers. For most people, those are located in the left hemisphere. So you see, the symptom is like a map, pointing us to the location of the damage. And while a lot of stroke symptoms can overlap, there is one that is a massive red flag for hemorrhagic stroke in particular. It's the sudden onset of a severe headache, often described by patients as the worst headache of my life. When a clinician hears those words, their brain immediately thinks bleeding. Now, in really severe strokes where there's a lot of damage and swelling, we can see these really devastating signs of abnormal posturing. On the left, we have decretit posturing, where the arms are flexed inward. This tells us there's damage to nerve pathways above the brainstem. On the right is decerebrate posturing, with the arms extended. This is an even more ominous sign, pointing to severe damage in the brainstem itself, the part of the brain that controls our most basic functions. So, we've spotted the signs. The alarm has been raised. Now what? Well, now the clock is ticking, and the entire medical response is built around one single idea: speed. This number right here is absolutely critical. For an ischemic stroke, the kind caused by a blockage, the best case scenario is to give a powerful clot-busting drug within 3 hours of when the symptoms first started. Every single minute that goes by, millions more brain cells die and are lost forever. This is exactly why we say time is brain. So when a potential stroke patient gets to the hospital, the very first thing they do is a non-contrast CT scan. And the reason is to answer one simple but life-or-death question: is there blood? On this type of scan, blood shows up as bright white. If you see that, you know it's a hemorrhagic stroke. And that is crucial because you absolutely cannot give a clot-busting drug to someone who's actively bleeding in their brain. It would be catastrophic. And this table gives a great little summary of the clinical clues that can help tell the types of stroke apart, even before you get a scan. Check out the onset. An embolic stroke, from that traveling clot, is often lightning fast, while a thrombotic one can build more slowly. Another big clue? Consciousness. A major bleed often causes a patient to become lethargic or even comatose pretty quickly, which is much less common with an ischemic stroke. And this all leads us to the treatment, which, as you can see, is completely different depending on the cause. For an ischemic stroke, the goal is simple: get rid of the clot and restore blood flow. We use a drug called alteplase, which is basically a clot buster. For a hemorrhagic stroke, the goal is the exact opposite: stop the bleeding. The first move is to get their blood pressure way down to reduce the force of the bleeding, and sometimes emergency surgery is needed to relieve that dangerous pressure inside the skull. So let's just recap the entire story here. It all begins with a simple fact of physiology. The brain needs constant blood flow. Then something goes wrong, a blockage or a bleed, and that flow gets interrupted. That interruption causes specific neurological signs based on what part of the brain is being damaged. And finally, the entire logic of treatment is to directly attack that root cause, get rid of the block, or stop the bleed as fast as you possibly can. Okay, I'll leave you with a question to chew on. Remember our patient with expressive aphasia? She can understand what you're saying to her, but she just can't form the words to reply. Based on that very specific problem, which famous specific area of the brain, the one responsible for the motor part of producing speech, do you think has been damaged? It's a perfect example of how a sign we see on the outside can point us to a very precise spot on the inside.